I'm taking a blood thinner, Coumadin, which I'll be on the rest of my life. So I know for a fact if I didn't have a blood thinning agent back in September, I'd be dead. Like the blood clots in my portal veins, mesenteric veins, were, pretty extensive, getting worse, and they would have gone to my lungs. I would have gotten a pulmonary embolism. I would have died without the use of blood thinners. I know that for a fact. So we have to be grateful for conventional medicine. I think the key is when to use it, right?
Yeah.
And I think that in the disease state world of conventional medicine, those types of therapies are game changers. They're life-saving. And we can use that if we need antibiotics, if you're in the hospital, if you're in the intensive care unit. And really, I think it's all good. I like for people to have options. And what I enjoy getting up every day is seeing patients and presenting those options. What's been ignored or kind of segregated out by the conventional medical world, in many respects, the mainstream media world, are these kind of more ancient healing modalities, like we're talking about, that, using nutrients, using fitness, using thought patterns, meditation, all these things that we can put together, combine with some pharmaceuticals. That's where we see, I think, the greatest growth. For me, yeah, I developed the severe abdominal pain in August. Lasted about 3 weeks, finally got a CAT scan, had extensive blood clots in my liver veins, went to the hospital, got put on blood thinners, and I've done great since then. We don't really know why. I think we've tested things upside down, can't really find a reason. It's very, very fluky, but I learned a lot from that experience and certainly have gratitude for it.
No, that's amazing. People who are seeking performance medicine, who's understanding that, hey, we shouldn't just be reliant on medications, seem to shun conventional medicine. But I think there's a time and place for everything. And I think there's a lot more we can do to prevent. There's a lot more we can do to make people better. But there is a role for some of the amazing advances in conventional medicine.
Yeah, and even if you take something like a natural molecules like peptides, but we've learned that we can inject them, is going to work way better than swallowing them. Like
Right.
that's using technology, and we can't shun the fact that the advent of pharmaceuticals have led us down this path in amazing ways that we certainly need to incorporate in our toolbox. I just think most doctors and most providers come at it with this sense of like that's the only option. And I know you subscribe to the same philosophy I subscribe to, is we want lots of tools for our patients.
Hey, I hope you enjoyed that episode. If you're finding this podcast to be valuable, if you're learning a lot, please share with your friends and family members. And please consider leaving a 5-star review at ratethispodcast.com/ThriveState. That review is really going to help the show grow. And if you haven't already, pick up a copy of my book, Thrive State, at thrivestatebook.com. I would love to connect with you on Instagram, Facebook, YouTube, TikTok, and LinkedIn at KienVuMD. Remember, you are your best medicine.